All right, so when we were talking about the peripheral region, we said the peripheral nervous system was everything outside the spinal nerve roots, everything outside the bony part of the nervous system, or the skeleton. So the spinal region includes all neural structures contained within the vertebrae. So really, for the learning objectives for this section, I just want you to be able to identify the following spinal region structures and what they contain. So the dorsal root, what's contained in that? The dorsal root ganglion, we know that's the bodies of the peripheral sensory neurons. The ventral root and the spinal, and each spinal nerve. So the spinal region includes all the neural structures contained within the vertebrae. So in this picture, it's a horizontal section that includes the vertebra and the spinal cord and roots and the spinal nerve and rami. So the rami are the different arms of the root that it divides into. So the white part here that looks like a tooth is that's the vertebra in horizontal section. The bottom part is the body of the vertebra and the top is the neural arch. So you can see the meninges in here as well. So that is what's considered the spinal region. The spinal nerve is formed of axons from the dorsal and ventral roots, and the division of the spinal nerve into dorsal and ventral rami marks the transition from the spinal into the peripheral region, and then we're out there in the periphery. So spinal nerves carry all of the motor and sensory axons of a single spinal segment. In the cervical region, the spinal nerves are found above the corresponding vertebrae. So C1 nerve is above C1, C2 nerve is above C2. Get that? Until you get to C8. Because we know there's no eighth cervical vertebra. It goes from C7 right to T1. C8 comes out below C7, between C7 and T1, and after that, the remainder of the spinal nerves lie below the corresponding vertebra. So the T1 spinal nerve comes out below the T1 vertebra, all the way down. Okay, so there's this diagram from the book, which I really like. It shows the lumbar and cervical enlargements, and the cord is a little bit bigger in the lumbar and cervical area because that's where all of the innervation from the extremities is coming into the spinal cord. So you get that enlargement because there are more nerves in there. So there's not an exact, the anatomic relationship is a little bit different because the spinal cord is shorter than the vertebral column. So your spinal nerves, your spinal segments, correspond a little bit differently. There's a chart in the book on page 353 talking about the anatomic relationship between spinal cord segments and vertebrae in adults. In children, it's going to be a little bit different. So just really know that the spinal nerves correspond to the they're above the corresponding vertebrae in C1 through 7, and then C8 messes everything up, and they come out below the corresponding vertebra in the rest of the spinal column. So segmental organization is a significant feature of the spinal cord. Each segment of the cord is connected to a specific region of the body by axons traveling through a pair of spinal nerves. So the connections of the nerve rootlets to the exterior of the cord indicate the individual segments. So it's kind of cool, this little segmental arrangement. The segments are identified by the same designation as the spinal nerves. So when we talk about the L4 spinal segment, it refers to the section of the cord whose spinal nerve goes through the L4 intervertebral foramen between L4 and L5. However, within the cord, the distinct segments are not really evident. because of that vertical column arrangement that we've already talked about. There's a continuous vertical column from the brain to the termination of the cord. So that segmental part is at the intervertebral foramen. So the ventral root is composed of motor axons. The dorsal root contains sensory axons. So the somas of the sensory neurons are found in the dorsal root ganglion. So the spinal nerve consists of all sensory and motor axons connected with a single segment of the cord. So out there in the periphery, when we're talking about the myotomes and the dermatomes is the area of the cutaneous area that's innervated by a single spinal root. And the myotome is the muscle that's innervated by a single spinal root. So here's where they're connecting together in the spinal region into those individual spinal nerves. Pretty nice organization, huh? The spinal column also has a great internal organization. Usually we look at it in horizontal sections. And really throughout the spinal cord, the white matter surrounds the gray matter. So we know the white matter is the axons. Those are those tracts that we talked about. So the dorsal column, the anterolateral tract, the spinothalamic tract, all those different things that we've already talked about, that's the white matter in the spinal cord. So the white matter contains the axons that connect to the various levels of the cord and link the cord with the brain. The axons that begin and end within the spinal cord are those interneurons. Okay, so cells with long axons connecting the spinal cord with the brain, those are the tracts that we've already talked about. So really the dorsal and lateral tracts of white matter contain sensory information. So in this picture, they are painted blue. And then the lateral and anterior white matter consists of motor tracts, and in this picture, they're red. So specific tracts we already talked about, but then we're starting to bring it together now into the spinal region. So the central part of the cord is gray matter, and it has a sort of distinctive H-shaped pattern, or if you prefer, a butterfly-shaped pattern. But it's usually referred to as an H shape. So the lateral sections of the spinal gray matter are divided into 3 regions called horns. And so we'll look at this picture next, which just has the gray matter. There's a lot of detail in the gray matter divisions that we are not going to go into. You'll be happy to know. But basically the dorsal horn, which are in this picture, it's at the top, processes sensory information. The lateral horn processes autonomic information, and the ventral horn processes motor information. Okay, this is going to come into play when we start talking about spinal cord injuries and what is affected, what is lost, and what is spared in a spinal cord injury. So the dorsal horn contains endings and collaterals of first-order sensory neurons. It contains interneurons and the dendrites and somas of some of the tract cells, the sensory tract. So the lateral horn is present only at T1 through L2, and it contains the cell bodies of preganglionic sympathetic neurons. So that's our autonomic nervous system. There is a region analogous to the lateral horn in the S2 to S4 spinal segments that include preganglionic parasympathetic cell bodies. So the ventral horn is primarily cell bodies of motor neurons whose axons exit the spinal cord via the ventral root. So there's a real organization, there's a real structure to the spinal cord, which I think is amazing, really. So a lot of the gray matter, even though we have all the cell bodies that I just talked about, a lot of the gray matter is composed of spinal interneurons. So the spinal interneurons include cells that remain entirely within the gray matter, and also cells whose axons travel in the white matter to different levels of the cord. So you can think of the spinal, sometimes we mistakenly think of the spinal cord as just being transporting information up to the brain, just being a conduit, but there's actually a lot of processing that goes on in the spinal cord, and it happens in the gray matter of the spinal cord. The meninges are layers of connective tissue that surround the spinal cord, and they're continuous with the meninges surrounding the brain. So the same three layers, pia mater, arachnoid, and dura mater. The pia mater closely adheres to the spinal cord surface, just like it closely adheres to the brain surface. The arachnoid is separated from the pia by cerebrospinal fluid in the subarachnoid space, and the dura mater is the tough outer layer. So this picture is of an epidural injection, and so epidural, it goes through the dura into the subarachnoid space, or sometimes it's called the interthecal space when they're doing epidural injections. And they do epidural injections for lots of different things. The spinal cord, of course, has its own blood supply. There are 3 spinal arteries running vertically along the cord, 1 in the anterior midline and 2 in the posterior, either side of the midline. So, you know, how anything has to have blood supply in order to work. So the spinal cord has to be able to move when we move. That makes sense, right? So when we move our body, some of those the movements of the limbs are directly transmitted to the spinal cord, and the nervous system is always assessing neural tension, assessing what's going on in the nervous system, and seeing how we have to respond to it. So some of the assessments that we do in physical therapy, the neural tension test, straight leg raise, that sort of thing, we're trying to see what happens in the nervous system in response to certain motions, and whether it replicates people's symptoms that they came in for. So hip flexion produces anterior movement of the cauda equina, stretching the lumbosacral roots. Our regular physiological motions do not significantly change the vertebral canal space in people with normal vertebral canals, but as you'll find out in your orthopedics class this summer, in people with vertebral canal stenosis, you will see some differences in the vertebral canal space with normal physiological motions. So extension or lateral bending of the neck increases the intervertebral foramen pressure at all cervical levels. Because we know the cervical spine is tiny, and there's not that much space. So when we extend or laterally bend the neck, it increases the pressure at all those cervical levels. Neck extension increases cervical nerve root signs and symptoms, if people have cervical nerve root signs and symptoms. So nerve roots and spinal cords are protected from excessive mechanical loads. There's a lot of space normally within the intervertebral foramen. So normally the nerves only occupy 23 to 50% of available space. So this is good. It means we have space to move. When you get stenosis of the intervertebral foramina, you end up with nerve symptoms. So because then you don't have as much available space. Cushioning by fat protects the nerve roots and spinal nerves. Yay, fat, right? The dural sleeves surrounding the nerve roots within the intervertebral foramen also protect them. And ligaments that maintain the spinal nerve within the intervertebral space and relieve traction on the spinal nerve. So we have a lot of structures in our body that are protecting the nerve roots and spinal nerves. And it's when those structures get compromised that we end up with problems. So the spinal cord, the individual segments of the spinal cord exchange information with other spinal cord segments and with peripheral nerves and the brain. Information conveyed by a motor tract to a motor neuron is only one of many influences on that motor neuron. So lots of processing going on in the spinal cord. It would be a mistake to think of it as just a conduit.